Dave Lover here, Vice President of Strategy and Technology for Aero Systems Integration. I've kind of been hosting and moderating a few of these Instant Insight webinars over the last several months, and we try to bring in some very smart people to talk about certain topics. For this series, we're talking about healthcare, but one of the first things that I found out as Mark and I were diving into this is the similar patterns of technology, and even though you categorize a lot of these things, these trends as healthcare related, it's actually substitute a new word, and now you're talking about almost any industry. And so I find that very interesting of the core fundamental things that we're trying to solve are very similar across all things, all verticals. So even though, yes, this is focused on healthcare, you'll find if there are any people that aren't here related to healthcare, you'll actually find some similarities to maybe things that are happening in your business. But with that, I want to introduce that smart guy, subject matter expert, Mr. Mark Wexler. Mark, hi, welcome.
Yeah, thank you for not using the word expert. Smart guy is okay.
Smart guy is okay. Well, I've known you for a long time, and we first got to know each other via kind of the healthcare vertical, and kind of opened my eyes to some of the things that are going on in that industry. So first, thank you for that, but I'm very happy to have you with us because we've got some cool things and very interesting trends that are happening within healthcare, and just how we can, whether we call the word solve or impact or contribute to the some of these healthcare issues, I think is pretty amazing. So maybe how we could kick this off, one of the things that I'm kind of noticing, and I have, this is a little bit personal for me with the whole healthcare topic, because I have a father who is kind of changing some of his independence and some health issues, and so I'm living this world as a consumer of it. So a lot of these things are, I feel like I'm becoming more of an expert, and not even necessarily wanting to, unfortunately, but yeah, but one of the things that I find really, really interesting about this is, and this is one of Mark's slides, and I'll let him talk to it, but I love this idea of, maybe even some level setting of definitions of, when we talk about the healthcare payer, that very traditionally used to be the insurance companies, right? And now I think that's changing, and with high deductible insurance policies that a lot of us have, all of a sudden the consumer, the patient, is playing that role of healthcare payer. And the private providers, typically, the hospital, the clinics, the people that are actually delivering services. But even that separation is changing quite a bit, right, Mark?
Oh, it's unbelievable how the market has changed over the past 5 years, and how it's going to continue to change. I think, David, just to try to relate back a little bit to your experience with your family now, you're experiencing some of the frustration as well as some of the opportunity as the healthcare consumer and the healthcare patient gains control over the care, the services, and the resources that they bring to bear. And I suspect, without going into a lot of detail, that some of the frustration and frustration you're seeing over your experience is the lack of coordinated communication from a security, from a validation, and from an identification standpoint in terms of who's the patient, who's the healthcare consumer, and frankly, who's going to be responsible for the payment, whether it's a government institution or whether it's a private institution. What we're really seeing is this morphing from individual roles and functions. For example, an insurance payer used to be just that. That's all they did. And a healthcare provider, that's all they did. And what we're really seeing them do is now morph into these healthcare companies where they're dual roles. And there's some real interesting examples of that. I mean, think about, well, most people, I suspect, would recognize Kaiser as a healthcare provider. Well, they're also a healthcare payer. They're really a healthcare company. There are any number of different companies that they now call networks. For example, Allegheny Health Network, which is based out of Western Pennsylvania, which happens to be where I live. They're both. They've got a complete system of hospitals. They've got a complete system of healthcare payer and management services, and it's very difficult when you're talking to them to figure out which side you're talking to. It even gets a little more complicated from a communication standpoint, because in many cases, what you'll find is that you're not even talking to the payer or the provider. You're talking to a middleman that either the payer or the provider has contracted with to help you. So in some situations, for example, in the New York area, when you call to make an appointment with a physician, you may not in fact be talking to the physician's office. You may be talking to a middleman out of a very large call center or contact center that is facilitating the communications, that has access to some subset of your patient health care records, and understands the clinic schedules, the physicians, their specialties, and so on, and drives that transaction for you, not only from a scheduling standpoint, but from a payment preparation standpoint to make sure that the appropriate monies can actually be acquired from whatever the right resources are. So it's becoming pretty convoluted, but communication is core to all of this.
Well, and I think that's, again, I can appreciate those systems that have our care, from end to end, where I don't have to help facilitate some of that communication across those, between the individual business units. I can really, really appreciate the ones that are doing it well, because it's a very different experience. So this whole idea of coordinated care, I think, actually, or I think coordinated communication of care becomes a pretty critical role to a lot of this stuff. But the other trend that I think is really interesting is, as you go from that, how it used to be before with separate services and very siloed, hey, this is my part of the puzzle, to the combined healthcare company that's both the insurance company and the provider. At the same time, because you'd almost think they're doing that to have control over everything, yet at the same time, I think I know I'm seeing the consumer having far more control over that process than they did before. And sometimes that's a good thing, sometimes that's a lot to have to take on, because you do have so many choices now, and you have to be an informed consumer. And I don't know if, maybe it's just because I've been thrust into that at the moment, but I never really thought of having it done that way in the past.
Well, it's interesting you would say the informed consumer, David. And we'll talk about this a little later on indirectly as a function of some of the trends. But it's because this has now become a competitive environment, these healthcare companies are really fighting for market share. And so one of the things they're really focused on and working very hard on is how to communicate with you so that you become as well informed as possible to make the choice to use them.
Well, and you and I did an interesting social experiment years ago, where I tweeted into an insurance company and asked them about their medical plans, or I forget exactly what I asked for, but
you actually, I remember you specifically asked where you could find a specific doctor that was local to your area.
And because I tweeted it, I never got a response back from that particular provider. Yet when we picked a different one, I had asked you.
It was a payer.
Yeah, it was a payer. You're right. And I asked you, hey, who's Bleeding Edge? Who's living this stuff? And you gave me a name, and we ended up tweeting that one. And I got a response within 4 minutes. And that was pretty powerful. And for someone who is choosing to communicate in a certain way to get that branding, you mentioned, they're fighting for market share. Boy, the last thing you want to be is difficult to get in touch with, in the way that you want to be communicated with. And so you're going to see a lot of that. And again, this is not new stuff. This idea of blended multi-channel omni-channel customer experience things in what we traditionally think is the contact center just becomes even more important as a lot of these things happen. But so when we talk about some of those trends, we talked a little bit about the business side of this and the competition, and in the enterprise space, the non-healthcare, we think of net promoter scores, right? There's so many things related to the net promoter, and executives are their compensation and their bonus is based on that single score. I'm seeing that more and more often, and it really comes down to how was your experience? And it's somewhat of a subjective question, but it becomes a number. And we, in the healthcare world, we have the equivalent of a net promoter score, and it's called the HCAP scores. And I find that fascinating, again, seeing the parallels between and across a lot of these various vertical industries.
And this all goes back to healthcare becoming a business now as opposed to a philanthropic endeavor or and I say this very tongue-in-cheek, or a hobby. I mean, the joke in the industry up until recently was that physicians are lousy business people. You do what's necessary, or you do anything and everything possible on behalf of the patient, and damn the cost. And that's just not the case any longer. So what you really look at here is, from a competitive and compliance standpoint, the federal government has put mechanisms in place to try to drive payment structures, and that's part of what this HCAPS thing really is. But more importantly than that, when you look at it from a competitive standpoint and from a business standpoint relative to cost and operational expenses, there is just a major investment going on in terms of improving the communications infrastructure. And I can give you just a couple real quick examples of that and how that's really being played out in the industry. Think about when the physician asks you or tells you that he wants you to go get an MRI. And I didn't really know a lot of the details around this until actually, I guess about a year and a half ago, when we started working at a very detailed level with a client who's deeply embedded in this particular end of the business. Well, there are a couple different kinds of MRIs. So which one do you want? And my immediate knee-jerk reaction to that was, oh, well, you want the cheapest one. What this interim business does, or this middleman does, is when you call to get the test authorized, you're not calling the healthcare payer. You're actually calling this middleman on behalf of the healthcare payer. The healthcare payer is actually contracting it. And what happens is, as a function of that contact center, they have experts, and by experts I mean not only really highly skilled agents, but they've got licensed nurses and physicians on staff. And they look at the test that's being requested, as well as all of the supporting information that has to be provided, and will approve it or deny it. And what I learned as a function of this, really interestingly, is a significant portion of the time when the physician tries to prescribe and get the inexpensive MRI authorized, it's denied, because they want you to get the more expensive MRI. And the reason is, the more expensive MRI one time is much less expensive than getting the inexpensive MRI and then having to go get the expensive MRI. So let's get it done once, let's get it done right, let's get it done efficiently, but let's rely on the communication systems to not only make the requests, but also to complete that transaction as quickly as possible, so that the patient can get what they need in an effective manner.
So,
Make sense?
big time, yeah, and again, living it. I think in terms of some of the overall, we're going to see these themes throughout the remainder of this hour, and to kind of talk about how, what very specific items and what's happening, but, in terms of productivity, again, not unique to healthcare, but this idea of growing shortage of skilled workers, and how do you provide augmented reality, maybe, augmented services, augmented skills to things. We'll see examples of that, and how that directly applies to, today's world of contact centers. and it's just kind of focused with to healthcare. But you know, again, healthcare is a business. The competition, compliance, quality of care. These are some overall trends we're going to see popping up throughout this, and ways. We'll talk about some of the technologies that can help with that. And the idea is, you know, today is really about this high level, you know, getting everybody on the same page as to what some of the issues are, and to educate some of our more technology-oriented customers on, you know, what to get buy-in to get your quote-unquote PBX upgrade or video or whatever. You have to put these things in terms of the things that the business is going to care about. So that's a lot of what today is. And then, you know, the remaining 2 sessions in the series throughout the next couple of months are going to be more, hey, let's talk about some specific technologies and dive into some of those details. We'll absolutely introduce them today and talk about them high level, but we'll go into more detail later on. Now, so we talk about, you know, trends, right? Trends are always interesting because it's not a statement of this is what's going to happen, although sometimes a lot of people think it. This is where we see the world going, and I think what's interesting is as we talk about currently where we see the world going, it's always interesting to go back a little bit in time and to see, well, where did we think this was going to go before? And so here, you know, we talk about some of the kinds of things that were forecasted to exist in 2016. You know, what do you, this first one, the idea of the consumer, again, the patient of this, you know, having video consults, obtaining a prescription for a health application like an iPhone app, or using their smartphone as a diagnostic tool. How did that go? How did that come to fruition?
The answer is yes, and the answer is no. It gets pretty interesting. For 2016, you can see at the bottom of the screen, this is not me forecasting. This was actually Healthcare Business and Technology and some of their forecasts. But they were forecasting that the groundswell would really take off, and they were using astronomical numbers in terms of the level of the population that would really, for the first time, start to use these kinds of services. They were right in that these services really are becoming available and starting to be used, but the key is starting, as opposed to we would reach a level of full adoption. So, for example, and we'll go through a little bit of it a little later on, but right now, as a function of dietary nutrition requirements, there are applications that you actually get prescriptions for and have to use as a function of your diagnostic treatment. People are using smartphones really as diagnostic tools, and in pretty interesting ways, which really embrace all the communication capabilities of the smartphone, as well as all the back-end intelligence of some of these sophisticated IT applications. As an example, there's an application being used today which really helps physicians to diagnose depression. And it uses the GPS on the smartphone as well as an activity log, which the individual fills out, and as a function of knowing where you are and getting a general sense for what you're doing, the physician can determine whether you are about to enter an episode of severe depression or not. In other words, are you leaving the house enough? Are you staying out long enough? Those kinds of things are being tracked from an analytical standpoint. But what's really
go ahead.
Go ahead. I'm sorry, David.
Well, I was just going to say, we're kind of living this even with an Arrow, right? I think it was 2 years ago, we had, as part of our insurance plan, so this wasn't necessarily a provider thing, it was a payer thing, but we, for the very first one, video consults, that was an approved standard method to, you want to see a doctor via your iPhone or your iPad, here's the price, and there was a lot of internal advertising, or even, using the...
and I used it.
Yeah, how good experience? I mean, clearly it's not meant to replace every customer visit, right, or every doctor visit, but I think...
But on a Sunday morning when you're desperate, it worked.
Yeah, well, big time. And I think also even today, last year we did the same thing, where we get a certain amount of dollars added to our HSA accounts if we log our our various health data, whether it's the number of steps, whether it's your blood pressure, whether it's whatever. We literally get $2 a day for every time we log and keep track and monitor some of those things. And so it absolutely influences and promotes the idea of being an informed patient, an informed consumer, because it's being kind of shoved in our face to, I want you to track it. They don't even care what the values are. They just want us to start tracking it so that we see, like, oh my God, I am really lazy, aren't I?
What's funny about that? My wife and I have made that application, that incentive, into a game. See who can get the most exercise on a weekly basis, and it's actually helped us.
And see, that's fantastic. Yeah. And I think we talk about it from a consumer standpoint, and whether how whether adoption was because of actual usage. For me, from a technology standpoint, I look at this and say a lot of those things that are video, right? And I think of, at the most generic technology standpoint, I say video into the contact center. That was really, 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 really hard in the old days. The idea of, if it was going to be browser-based, there is no such thing as multimedia in a web browser until you install something like Adobe Flash, or maybe Microsoft's Silverlight. Maybe you go to HTML5 with maybe WebRTC. Those things start augmenting the ability for a web browser to do multimedia, like video. But before that, it was tough, and you'd have to have a dedicated app. You'd have to have a dedicated environment for that to work. And so I think that restricted a lot of people's adoption because the technology integration was difficult. And what we're seeing across the entire universe of communications is how most of the manufacturers are starting to really open up their software via APIs and specifically RESTful web services, that now I'm not so tied down to, are you conforming to the protocol standards, which is what I had to worry about before, but now am I allowed to access your stuff through your web services? And now, instead of integrating at the protocol or the vendor level, I can now integrate at more of an ecosystem level. And as a systems integrator, that is changing the game for us, because it's easier to connect these things together than it's ever been.
Couldn't agree more.
So,
couldn't agree more.
If we move forward and we say, okay, let's talk about some of the items in the list of 2017. Again, to your point, it isn't our list. This is PwC's top health industry issues of 2017. It's documented. There's a number of things on here, and some of these are cute little titles. Again, not ours. This is what was listed in the article, but I wonder if we could go through these somewhat quickly, high level, and then we'll go through and drill into maybe three of them. But when we think of the first one, right? When we think of the Affordable Health Care Act and ACA, what's with the fate of it? What does that mean in terms of 2017?
Well, so ignore what's going on in Washington, because that argument is really about healthcare coverage. It's not about healthcare payment or about services or delivery at all. Everybody agrees as to what needs to be done from a quality of care, from a patient satisfaction, and from a services standpoint. But what this really means from a communications industry is that we're going to continue to see everybody, and by everybody I mean the payers and the providers and the middlemen, trying to figure out how to get closer to the patient as a function of proactive, meaningful communications with them. Much of that, if not all of it, we'll see driven through, through contact centers and through smartphone kinds of applications.
So, and I would imagine that there's going to be changes in plans, right, which may cause people to move around and change their insurance plan, and that, at some point you have
a marketing application.
That's a marketing opportunity.
Right?
Yeah. This is about marketing and making sure that you're ready for the people who want to buy from someone, that they choose you, right? And that becomes this upheaval, right? In chaos, there is opportunity, and I think this is where everybody has to be ready for that. And again, the first thing I think of when I go that direction is the contact center. And are you expecting everyone to call you in order to explain what's happening there? Now the next one, pharma's new strategic partner. Explain that one a little bit.
Well, we'll go into that in a little more detail a little later on, but the new partner is you and me. Pharmaceuticals can no longer market and sell directly to the physicians and the providers, so they're going to do it to us. They're going to do it with us, to us, and for us.
Is
they're going to try.
Is that all the advertising that we see? You know,
that's the very start of it. That's the very start of it, but it goes much deeper than that in terms of the kinds of communication services that they're already rolling out and how they're supporting that with applications, contact center related services, and interactive collaborative applications to be able to promote, support, and educate you and I as consumers.
So when we talk value-based payments, the thing that I immediately think of is you will get paid based on a desired outcome. Am I reading that right?
Well, sort of. The way that it has been working through the HCA and through the business transformation has been that you get paid based on upside risk. In other words, if you can improve your quality, you can increase the incentives or the bonuses that you get. Now what they're doing is they're trying to shift to downside risk, being that if your quality is poor, you get penalized. Since everybody has started to make that turn, they're trying to make it much more painful to relax and go back in the other direction. And so what that really means from our perspective is physicians have to get much more interactive and proactive with the patient to keep them healthy as opposed to respond and then be proactive. So it's health all the time as opposed to let's get you healthy once you're not.
See, and that's interesting because in the past, that what you just described really was more of a function of the insurance company, right? And when I think of all the proactive, hey, you should be healthier, you should eat better, you should exercise, here, look at these programs, that never came from my doctor. It always came from my insurance company. And you're saying now that the provider, the doctors, they're the ones that are going to have to start picking up more of that role so that they get paid more.
Think back to what we talked about a couple seconds ago. I mean, it was unheard of 24 months ago to get a prescription for a nutrition application. Now you'll get that because they're going to put you on the road towards consistent behavior, consistent health, consistent wellness, and they're going to track and manage that because if they don't and they get bad results on the back end, they'll get penalized.
Yeah. Well, how about insert your card here? What is that?
Oh, really very, very simple. Given the high deductible plans that most of us now have, and carrying anywhere from $3,000 to $10,000 worth of deductible that you're personally responsible for, the way that people are starting to pay for this stuff isn't writing checks; they're using credit cards, and the vast majority of healthcare providers aren't prepared to handle that, particularly given the advent of some of the new credit card technology. So we're starting to see a major redesign and a new roadmap and evolutionary path being taken within contact centers to be able to handle these things.
Interesting. How about Dr. Drone? That sounds scary.
Oh, it's my favorite. It's my favorite. I mean, this is where communications technology and the Internet of Things really comes to play. And what it really amounts to is that, the healthcare industry, just in general, lags virtually every other industry in terms of the use of technology. They are really making significant investments now in artificial intelligence, virtual reality, automated equipment, data collection, and the communications infrastructure behind it to, of course, drive down cost, but as importantly, be as efficient, effective, and as proactive as possible.
That's cool. How about infectious disease sparks invention? What is that?
Well, so let's just talk about Zika for a second. It took far too long for people to understand that how that disease was spreading. With the advent of mobile communication services and the ability to simplify information collection as well as notification, we're seeing significant investment from people like the World Health Organization, as well as all the way down to your local municipal health and human services to build applications and communication services to be able to not only identify meaningful events like an influenza outbreak, but also to help you to proactively address it so that you can minimize its impact.
Yeah, see, the first thing I thought of when you initially described that was more at a, like the CDC, detecting some of those things. But you're saying it does come all the way down to the local level.
Oh yeah, oh yeah. I mean,
and like with parents and schools, where these congregations of people, that's just spread diseases like wildfire, right?
Yep, exactly.
Gotcha. How about new partnerships and collaborations?
Well, there's all sorts of new relationships being built. And David, you had actually provided a really good example of that I don't think we need to go further with. Employers and employees are starting to work together under the banner of the employer providing tangible benefits for some specific action on the employee's part. Another real simple example of that is Aetna gave 50,000 employees smartwatches with the appropriate application to be able to track their activity. That gives the employees some significant incentive. It gives Aetna some information that they need in terms of trying to drive and promote specific behavior. There's all sorts of examples like that now going on in the marketplace, but for the most part, there is always or for the most part, the majority of the time, there is a communications-related component of that where the employer is requiring feedback from the employee to assure the appropriate behavior and actions.
So, and I would imagine that a lot of these kind of blend together, but I think of the idea of there's some ridiculously expensive medicine that might be part of a treatment plan, and the only thing that makes it even more expensive when you don't take it the way you're supposed to and end up having to take it twice. Right, so compliance to medicine and just and I would imagine I think automation, I think Dr. Drone, I think of pharma's new strategic partner. It's in their best interest to make sure that their medicine is consumed correctly, and to make sure that it's delivering the effectiveness that they were hoping for.
All efforts that are underway as a function of these trends right now, and none of this can be done without the appropriate communication services.
So the last one, preparing medical students. That seems, one is, okay, I don't know if too many of us are really in the business of training med students, right? What's the connection to communication?
Well, we're not, but the reality is that the vast majority of devices which these millennials are using, we're responsible for at some level from a communications, a functionality standpoint, from an application standpoint, from an infrastructure point of view. So, it really comes down to these new physicians gaining access to applications and wearables and devices that give them the ability to A, communicate in the manner that they want to and need to, and B, to make them as efficient and effective as possible.
See, I think that's interesting in and of itself, the idea that you said the millennials, and sometimes you think, again, in the rest of industry, we don't make those assumptions where, hey, if a millennial comes into the workforce, oh, don't worry, they'll adapt to our old school ways of thinking. No, they don't. None of them.
No, they don't.
What they do is they segment themselves if they can only communicate effectively within their own group. And I guess I never made the connection that even medical students are, in fact, millennials. And they're...
That just says how old we're getting.
Yeah, I know. Well, it's even worse. I think I told you, but my son, he's 18, my oldest, and he was at basically it was an honor band weekend at the University of Minnesota, and he just came back so excited about all the people that he met, and he really hoped that he had that they'd all stay in touch. And of course, me being the advisor father, I said, well, did you make sure to give exchange email addresses? And he's like, yeah, Dad, right after we gave each other our fax numbers. What are we, 40? And I'm like, mother of... and it turned out their method of choice is Snapchat. So he's like, yeah, we created a Snapchat group, and that's how we communicate. And again, clearly there are requirements for security and everything else related to medical students, but communication in the way that they are going to be most effective is going to be critical. So it's an interesting kind of connection that we all need to make.
Absolutely.
So let's take some of these and go a little bit deeper. Maybe talk about some of the technologies that go with it. And I think, we hit on a lot of these already, but the pharma's new strategic partner, insert your card here, Dr. Drone, and preparing med students. Let's talk about some of those. So the whole idea of the pharmacology and the creation of drugs and the use of those. What are some of the big things that are happening there?
Well, so real quickly, let's talk about the driver here, which is drug prices. We've all heard stories about it used to cost $40 and now it costs $1,000, and how can the pharmaceutical companies do that to us? And they come back with all of the logic behind it, which some of it is market-driven, some of it is maybe a little bit too much capitalism in cases, but a lot of it is a function of overhead that's required and cost structure that's required for R&D as well as for management and tracking of the efficacy and results of the pharmaceutical itself. So it's going to be no surprise to any of us. I mean, just sit down at your television anytime, day or night, and wait for the Viagra commercial, wait for the Trulicity commercial, wait for the whatever commercial around whatever 2, 3, or 4-letter acronym you want to deal with, COPD, CHS, whatever. The pharmaceuticals are now trying to make us their greatest proponent and greatest ally. And the way that they're doing that is pretty interesting. They're really now starting to look at not only the marketing, which is obvious, but also back-end applications that they can proactively engage us in to not only collect information regarding use, but also to drive education and drive, frankly, customer loyalty. So think about Trulicity just as an example. Trulicity is pretty interesting. If you're a type 2 diabetic, there's a really good chance that you cause that as a function of your diet. Once you've created that problem, it just doesn't go away. It has to be managed for the rest of your life. For certain kinds of type 2 diabetes, rather than sticking yourself really before every meal or after every meal or once a day, you may be able to use this medication, which is once a week. But it's packaged very uniquely and has to be injected in certain spots in your body. It requires a practical level of education. It requires some level of monitoring, and it requires some level of feedback and collaboration with not only your physician, but potentially with the manufacturer. Well, they developed an application, which is a smartphone application, which allows you to really not only track, but also to manage your use of this medication. And obviously, they collect the data from this. They collect it for marketing purposes. They collect it for efficacy purposes. They collect it for all sorts of reasoning and logic. These kinds of communication systems and the back-end services that support them are really, really new in the industry. If you look at IB data, that one's even more interesting in that you have to get a prescription for this application. Now, what's IBD stand for? We won't go into the details of it, but it's Irritable Bowel Syndrome, Irritable Bowel disorder or disease. It can be pretty nasty. What this smartwatch tracking app does is give your physician the information regarding things like your water intake, your heart rate, the amount of exercise you're getting, as well as symptoms and results that you get from taking the appropriate medication. This is, again, another kind of back-end application that's linked to the front end, being you, the patient, the consumer, that was unheard of a couple years ago, but are being developed and promoted by the pharmaceutical companies for two purposes. One, to sell their drugs, and two, to sell their drugs.
Yeah, but I think, like like you said, is the idea of the collaboration that happens now that you just couldn't even dream of. I think most doctors they'd fill out a prescription and you leave and they'd come see you later and see 6 months later or a year later, did that drug work?
Right.
Clearly, different treatments and different problems have different types of follow-up, but boy, it's hard to beat the idea of getting kind of a daily analysis of that and being able to adjust some things on the fly. I think that's pretty powerful.
Well,
and to your point, okay, it starts with an app. It starts with maybe some kind of an IoT integration. One of the really cool things that Arrow is doing, because again, in the IoT space, we're a pretty big deal. We're a big name. We're working with EpiPen manufacturers to build cases. The container for those, that once the container is opened, it automatically notifies caregivers, parents, and it notifies the pharmacy to say, hey, Jimmy just used his EpiPen, let's get another one on order, so that there's no gap in between, having these things available. So it's pretty powerful of just the true collaboration that happens across not only the drug side of it, but the treatment and the monitoring and everything else. It's pretty amazing. So how about with credit cards and the reliance on that? What are we talking about here? And again, what's the connection with communication?
Sure. As I said before, with these high deductibles that we're all now carrying, the vast majority of the time people are now paying with with credit cards as opposed to with check and with cash. And significant number of the billing collection and payment systems that the providers have don't support it in an effective or in a manageable way. Consider several things. If you just yank out a credit card that was sent to you recently, there's more than likely a chip on it. What you may not be aware of is that once these chip systems are fully deployed, the credit card company will no longer accept responsibility for a fraudulent charge if the card has a chip on it. It is the business's responsibility to accept and eat that charge. So the next time you walk into your Home Depot or into the grocery store or whatever, and they tell you to swipe the card as opposed to stick it in the reader and have the chip read it, they are accepting the liability of the fact that that card may be stolen and you're stealing from them. The credit card company won't guarantee the payment. That same requirement is now falling into the falling onto the shoulders of the providers. But the problem is, how do they get that chip identification given that you're remote? Well, the reality is they can't. So what you're now seeing is significant investigation, significant investment into contact center systems that can much more effectively and accurately identify and confirm you for who you are, and you as the payer, and you as an authorized user of that credit card. You're going to start to see many more security services put into place, either overtly or through back-end systems to minimize potential fraud, and frankly assure you of far more credibility relative to payment authorization and billing purposes. But that's only part of it. The other thing that's that's happening here is that the contact center, from a communication standpoint, whether it be through a web browser, whether it be through chat, whether it be through some new video services that are coming down the pike from a WebRTC standpoint, for example, they're now starting to really look at multimodal communications as required to be able to further validate, interact, and complete the transactions with the with you, the payer. We are now past call centers in all respects. We are now fully into contact centers at the healthcare provider level, and very rapidly moving into this notion of omni-channel.
I think when we start, in the standard non-verticalized terminology, we talk about that customer journey, and the companies who think call center and they even think contact center are thinking very much in terms of individual transactions. Somebody called me, I answered in the fastest time available. I maybe had a screen pop, and you measure that transaction in usually seconds. Maybe 120 seconds, maybe 180 seconds, but it's in seconds. Whereas, well, if you think about the bigger picture of that, of where the entire customer journey happened, it started potentially days or months before, it'll end days or months after, and it had a whole bunch of different transactions, and to be able to look at that holistically and leverage all the channels that are available to you become pretty important. And I think one of the things that we are finding more and more is, there's absolutely a lot of industries that are saying, the use of call centers are declining because they are automating more and more of their self-help via web portals and everything else. I've even heard some customers say that they view a call into the contact center as being a failure of the rest of their systems. So it's like, oh, fine, I couldn't handle this on the web, fine, I'll call your 1-800 number that you're telling me to call. And it's giving them indication of, okay, here's something we need to try to automate or build within the self-help environment. And as a minimum, what it's doing is raising the bar for the agents, because they no longer get the easy calls, because you automated the easy calls, but it's the complicated calls, and it could be the people that really don't want to call in to begin with, and they're already mad, and the worst thing you could do is present them with an agent who doesn't have a complete view of the journey and what that customer/patient has gone through. And so it's really changing the game, and it's certainly billing, we see that all the time, in financial we see it all the time, but it goes so broader than that, and every single aspect of this is going through the exact same issues, because the reality is, I'm a consumer in addition to being a patient, so it's all very much the same expectations.
Well, to that point, David, relative to healthcare, this could not be more important, because you want this payment process to be as easy and least stressful as possible, because the one thing you never want to bill from is your healthcare provider. That means that means you're sick, or you were sick. It's not something you want to go by. And so what we've been talking to our clients about is everything you've just mentioned, but we talk to them about it in terms of transaction continuity and completion, so that regardless where they start, regardless of how they interact, by SMS, by text, by email, by voice, and then back to the web, and so on and so forth, that transaction continuity can be preserved. They can complete the transaction in the manner and mode that is most comfortable to them at any given point in time, as a function of getting the information they need to be comfortable making the payment.
So let's move to Dr. Drone. Again, this is, and I gotta admit, I think the technical side of this, and at some point you could say, hey, it's all the literally the robotics, right? And what happens there, in which we don't personally play a role in. But in terms of the communication side that goes along with that, that becomes really big. And I think along with the Internet of Things, we're seeing that as a very non-traditional channel of the call center, right? Where we're seeing, my example again, I call my dad and I say, Dad, how you feeling? He's like, I didn't take my walk today. And I said, well, why? Well, my leg is, it was a little sore, and Dad, you should go see a doctor. And he's like, no, I'll be fine, not a big deal. Well, we're working with doctors who have a patent, right, and an idea that says, well, what if we automated that process and noticed that my dad's activity level had deviated from what was normal or predicted, which happens to be a very common thing once you hit a certain age, and could automatically feed into a call center. Again, I'm using that term call center liberally to mean so much more than calls, but all of a sudden it could go to a call center of skilled nursing people to say, how about I call Dad, and all of a sudden the nurse says, hey, how you doing, Mr. Lover? Oh, well, I didn't take my walk today. My leg hurt, and well, tell me more about this. You really should come on in and get this checked out. And I can get you in tomorrow morning at 9. What do you think? And so this idea of automated sensor level activity, whether it's a step sensor or maybe a full 6-axis motion detector, baselining movement, patternistically feeding it into a contact center, and then having the hospital call proactively. I think that goes back to the whole proactive side of this. Everybody loves it, right? The hospital loves it because it's new revenue, that it's additional revenue that maybe they wouldn't have gotten. The insurance company loves it because they've solved an issue before it turned into something serious. Dave Lover is happy because my dad's still alive. And so all of these things become extremely interesting, and you just have to start looking at the technologies being very independent or easily merged together to truly integrate things that just in the old days would have been hard to do, and now I can tie these things together. So I had one specific example, but I'm curious of your world of this and how you see a lot of the Dr. Drone kind of come into play.
Yeah, so I think that your example is right on target. What this automation is really doing is simplifying a lot of the repetitive tasks that, in fact, healthcare workers don't need to be involved with. But more importantly than that, if you look at healthcare delivery as a supply chain, it really speeds up much of the information acquisition and the resulting action that has to be taken as a function of that, not only in the clinical space but also in the home space, as well as from a commercial standpoint, as it relates to medication management, as it relates to really obtaining the care that's required, and making sure that, in fact, it's being administered and having the appropriate effect that you want. So it's probably the greatest area of opportunity from a technical standpoint. It likely has the most impact from a communication standpoint, because none of this works without the communications infrastructure. But more importantly than that, once you get it connected, so what? It's how you enable it and use that information in terms of machine to person, machine to process, person to machine. It really drives that complete 360-degree view.
Yeah, the automation, the automated workflow is so critical. Yep. And when you think of the call center as, at the most agnostic sense, is an intelligent routing engine, right? Something came in and I got it to the right place in the most efficient way possible. If you look at that and then say, oh my gosh, for the first time it doesn't have to be a phone call, and no, it doesn't have to be an email, it doesn't have to be a chat, it doesn't have to be it could be the temperature sensor of a refrigerator that is holding medication in blood. It could be a activity tracker that a patient is wearing. It's all of these things. It's data coming in that is routed and processed intelligently, and automating everything downstream from that. And it becomes extremely powerful. And I agree with you. It's kind of the most fun of the areas that we see, because there's so much low-hanging fruit that you can go after in the healthcare world. It's pretty amazing. Lastly, Mark, we've got preparing medical students, and we kind of talked a little bit about the idea of the millennials and being communication-based. But you've got some personal aspects to this too, right?
Yeah, I do, and we'll go through it really quickly. We're starting to run short on time here, David. So the new generation of physicians needs to be, wants to be, has to be trained, utilizing the tools and resources that they've become most familiar with. And so what's happening is the medical schools and the hospitals are trying to adapt to be able to support them from several different perspectives. The first is that these guys, these students, are now being trained to understand the business of healthcare, and as a function of the business of healthcare, recognizing that in fact there's a lot of competing resources out there, and that they need to focus on the most medically complex of patients as opposed to the simple, quote-unquote, everyday patient. I mean, there are roughly 3,000 clinics in operation in the U.S., and almost a third of us have visited them at least once in the past 12 to 18 months. The medical schools are teaching these students to look at the medically complex as opposed to this kind of a patient, which can be dealt with through a physician's assistant or an RN. And by looking at these more medically complex, they're trying to give them the tools to do so, whether it's virtual reality for teaching aids. Unimersive's Anatomy VR teaching aid utilizes a Samsung Galaxy or an Oculus Rift to help students understand the skeletal, the nervous system, and the basic organs. They're giving them web apps and smartphone apps to as teaching aids, as well as for instruction for collaboration. And from a personal standpoint, I mean, I watched my son-in-law study for his medical boards using his smartphone and tablet. And it was not a one-way application. It was an interactive, immersive experience where he could collaborate not only with instructors on the back end, but also with his peers that were studying the same content for their medical boards, and figure out, you know, what the right and wrong way is to do certain things relative to different medical problems as they were presented. But more importantly than that, as these guys practice medicine, and again, I'm watching it through some personal experience with my son-in-law, he's now a nephrologist. He's communicating with his peers at the hospital and trying to with the nurses relative to patients, using his smartphone, using web apps, as opposed to, all right, I got a page, I'm going to come in and look at the patient. He wants to be able to utilize the appropriate technology to be able to diagnose efficiently and very, very quickly, and then move on so that he can deal with the science of the complex patient and figure out from a detailed diagnostic standpoint what that roadmap and procedural regimen should be to be able to address that individual's needs, rather than just, I'll spend an hour with them and figure out what I can figure out and move on.
Well, and I think that the mobility aspect, right? Everyone
Absolutely
wants mobility. They don't want to be locked down to a desk, and so the idea of providing a desk phone as your only form of communication is pretty archaic, and it's certainly something that these students and not even students, once you see the value, everybody appreciates it, but to be able to communicate from everywhere, not just, hey, can you wait until I get back to my desk? That's no longer an acceptable excuse, I think, with most people.
And what's interesting here, David, is that he doesn't even carry a pager.
Yeah.
He has a smartphone with notification services on it. He does not use a pager. And what I'm seeing as I walk into other facilities that have got teaching facilities or hospitals with teaching facilities, you will see less and less and less of, and I will use the term, antiquated communication technology like pagers.
And I think just like in the enterprise world, it is starting to influence the type of employees that you can hire, right? You know, because these people know the ways that they want to communicate to be most effective, and they are going to start picking companies, and in this case hospitals and clinics, based on the tools that they get to work with. And so we're seeing that all over the place, and healthcare is just no different from that. I think the big takeaway from this is there's communication technology everywhere in all of these. And you know, that's going to be a lot of our theme for the next 2 weeks, or 2 months rather, when we talk about some of the key actual technologies. And we'll do it both from you know, we'll call it team-based, which I think of more as being internally oriented, as well as customer-based, which is, you know, your company to your consumer, your patient. and some of the technologies that our customers typically interact with, whether that's contact center, whether that is IoT, whether that's collaboration, a lot of the traditional kinds of things that we've talked about today. We'll go into a little bit more detail about how, what specifically, what are some of the things that are happening and what are people doing.